Carol, how did your fibromyalgia start?
I was a very active teenager, and then I started to develop quite strong pains in my legs and my arms, and from that I also had some fatigue symptoms as well. I went to my GP at the time, who advised me that it's growing pains because I'm coming into adulthood, which I thought, okay, fair enough then, but why am I getting fatigue then? And I started to have irritable bowel syndrome. They then took over and said, well, you know, the cramps that you've got, it's pain, it's, you know, you've got shoulder pain, you've got neck pain, and it's like, well, you know, something isn't quite right. And I just kept getting told that it was down to growing pains, adulthood, and live with it, was the exact words I got.
At that time, what was your sleeping pattern like?
It was quite slow in the night because I was so exhausted of having to slow down during the day because of the pain, and then at night time I would often be woken up by the pain. So it was like the fatigue side kept getting worse and worse and worse as it went on. The pain was getting higher and higher and higher, but there was no reasons why I was having these symptoms.
Yeah, it's commonly the sleep disturbance is one of the first things that you see in fibromyalgia, and it seems a little bit counterintuitive that somebody's tired and yet can't go to sleep, but yet it's all part of the same thing. And that was the same for you by the sounds of things.
It was exactly the same for me until I was 19 when I got diagnosed with restless leg syndrome. Right. Which obviously has an impact on sleep patterns anyway. So my working day, I ended up having to work part-time for a period of time because the exhaustion of not having sleep because of restless legs, and also having the pain through the night as well as having the pain during the day, and having the fatigue during the day. It was just pure exhaustion. My GP then started doing tests for MS, lupus, and chronic fatigue syndrome. Which, you know, it was like, well, what have I got? I'm only 19 years of age. You know, I've never had any problems in my past. Why now? And again, when you're going back and forth to the GP, you feel a bit like a sort of hypochondriac because you're going back presenting things that you've got that you then start to think, is it all in my mind? To then think, well, you know, why am I at 19 years of age having all these symptoms and yet nothing's coming up?
Did you get any mood disturbance at that time?
I think the mood disturbances were more about frustration rather than mood swings, because I was frustrated of I couldn't do things that I used to be able to do, even getting up in the morning to do, get ready for work, you know, going night clubbing with your friends. After a period of time, it was like I've got to have a seat, I've got to slow down. And day-to-day tasks that you would normally just take for granted, I had to get my family members to do it, and I'm thinking, well, I'm going to be leaving home soon, and now I've got to ask my mum to do my washing and my ironing because I have got no energy and I've got no, I'm too much pain to even just stand up moving my arms, which I then obviously had the increase of the irritable bowel syndrome, which I put down to possible stress. But it turned out that it was, you know, it was part of the condition, and I'm now got intolerances, which obviously have got an impact of what I can eat and what medications I can take now for the.
Did over the time has your condition got better and worse?
I think over a period of 10 years. It did actually progressively get worse in that I was taking quite a lot of medications, and that I had to readjust my complete lifestyle to counteract with even studying for exams I had to do over a longer period of time because I just couldn't remember what I just read, and I had memory lapses and concentration. So if I was reading a book, I had to read that page but 2 or 3 times before it actually registered. And then by that time, I was too exhausted to start reading again. And it was more frustrating from the GP point of view because he kept giving me more painkillers, and he was giving me like amitriptylines, which I didn't want to take because I knew that there are side effects from medications. And it was like one big vicious circle that I had to go and adapt to. And it got to the stage that, you know, I'd practically more or less given up because I thought, this is just not me, this is just not who I am. And this seems to be, this fibromyalgia has taken over my life rather than me taking control over it, because nobody knew what to do with the condition and nobody knew how to control it themselves.
So we know that people with fibromyalgia can develop it at any age, and you unfortunately developed it at quite a young age. When did it actually all click that this was one entity rather than lots of different things?
I think it came to a head about 9-10 years ago when I had surgery, and I seemed to be recovering a lot less. I'm normally a quick recoverer, but this seemed to take quite a lot out of me, and I got a severe virus infection, and that's when I started to have, I could hardly move my jaw, I could hardly move my neck, my shoulders. Getting up in the morning seemed to be too much of an effort. It took about an hour to function, took about an hour to get dressed. I seemed to be going backwards rather than going forwards. And it was then that I actually saw a different GP who knew a lot about chronic pain conditions, that he said, I think we need to refer you to a pain consultant, I think we need to refer you to a neurologist and see what actually is going on in there, because it's not just something that, like a migraine, you could take a paracetamol, you could take a migraine tablet and it goes away. This was actually the whole body being like having the worst flu you could ever have and not being able to move, and having the worst toothache from the head to the foot, that 24/7, and just nothing was shifting this pain. Even moving your fingers, moving your arms, and I thought, this just isn't me, because I'm usually very, very active. And it was at that point that I, got told about fibromyalgia, and it was at that point I thought, right, fine, I now need to control this condition rather than let it control me, and I need to work around what I can do rather than look at things that I can't do, and then progress that way.
So during this prolonged period of time where you were being treated symptomatically, did you have a lot of investigations?
I did have quite a lot of investigations because, as I said, they thought it was lupus, they thought it was Lyme disease, then they thought it was MS. Then they said at one point it was all in my mind. And it was something I was making up, because there's no way that this one condition could have that amount of symptoms and that amount of linked in other conditions, linked in with this one condition.
How did that make you feel?
I think at the time, again, I was back to being frustrated because nobody was really taking it seriously and nobody was taking any ownership of exactly what was going on with me, sending me for MRI scans, sending me for blood tests, sending me for x-rays. It was just, and they were coming back as negative, and it was just like, well, what is causing this? So I think the frustration part is always at the foremost, because nobody was actually saying, well, let's take this, sit down, let's look at what's happened in the past, and let's look at what's happening now, to then address them, to actually say, well, this is what the condition is, this is what it means to you, and this is how we're going to manage it and move forward, because nobody knew what to do with the condition to move forward. And I know it mirrors quite a lot of people in the same way.
Sure. And so actually getting the diagnosis given to you, although it's not a particularly nice diagnosis to have because of the fact that it's with you ongoing, what did that mean when somebody actually said, this is what you have?
I was referred to a pain consultant, and it was over a period of time seeing him, and it was him that actually said this is fibromyalgia, and it was after I had the infection that I had the symptoms of I could hardly open my mouth, my jaw was painful, my ears painful, my neck and shoulder, I could hardly move my neck and shoulder, my arms, and it just seemed to be as if it was a light switch switched on, that he said, is fibromyalgia, and I said, what is it? Unfortunately, which seems to be the norm, or as near as, is I got told there was no publications, there was no leaflets, there was no flyers about this condition. It was, have you got access to the internet? Look it up. So when you look up fibromyalgia, there is a cure and people are treated and people can do this, and then when you realise and you speak to specialists that know fibromyalgia, there is no cure, it's just how you manage the condition, and it's at last, there's a name to what I've got. It's not all in my mind, and I can now focus on moving forward and treating and managing each symptom rather than running to the doctor with each symptom.
Thank you for sharing that story.
Okay.